Pharmacies are dealing with nationwide shortage of some over-the-counter children's fever and pain medicine. Now, Toronto SickKids Hospital is recommending that patients get a prescription for liquid Tylenol and Advil to ensure that they get access to the drugs. Megan Fitzpatrick is following the story, and she joins us from outside SickKids Hospital on University Avenue in Toronto. Megan, let's talk about this. What more do we know about this shortage and, in particular, the advice to parents from the hospital?
Yeah. We've been hearing that this has been an ongoing shortage for months, John. So parents who have had sick kids with a fever, maybe, who have gone out to a drugstore to get some liquid Tylenol or Advil, maybe found some empty shelves. So this has been an ongoing issue, supply chain issues from the manufacturers, as well as increased demand for these products. And so because of this shortage, SickKids did advise parents and caregivers of their patients earlier this week that if they do require these medications at home, once they're done being treated at the hospital, to get a prescription from their healthcare provider here at SickKids before they go home. And that's because while the store shelves might be empty for the over-the-counter products, behind the counter, some pharmacists still do have supply of these medications in liquid form, but more like in a bulk form. So they get the big bottles from their distributors. If people have a prescription, it would be much easier for the pharmacist to dispense those medications in smaller bottles and tailor it to that patient specifically in terms of how much they might need. So essentially, people need to be aware that these products are still in pharmacies, just in a different form. So if people are looking for it and can't find it on the shelves, don't give up. Talk to your pharmacist to see if there's something they can do to help you still. Earlier on News Network, CBC spoke to Dr. Samir Gupta, one of the health experts we interview frequently, and he told parents, don't panic and don't hoard these medications if you do see them. Here's more of what he had to say.
These are important, to be fair. You know, kids get viral illnesses, and when they have fevers, this is what we use. I have a kid, and when I heard about this, I checked our cabinet. That's what you do as a parent, quite naturally, I think, to see if you have any, because you often need it, and particularly now as kids are heading back to school, and we're anticipating more viral illnesses in the fall, COVID and other. So it's important, but you can get it if you need it. There may be that barrier of requiring a prescription, but as you heard, I think most pharmacists in these circumstances, knowing that if their shelves are empty, they will dispense it even without a prescription to parents for that one episode where they need it.
And there are other forms of the medication, like in chewable form. There's also compounding pharmacies that can help patients as well. So bottom line, John, parents should talk to their healthcare providers, talk to their pharmacists if they do think they might need this medication for one of their sick children.
In the meantime, any timelines on when the shortage might be resolved?
Not really. I mean, the Ontario Pharmacists Association has said that they, pharmacies still or sometimes get forecasts from their suppliers about supplies coming in, but those are never really guaranteed timelines for shipments. They do expect this shortage to go on for a while, and there is concern about that. As you heard Dr. Gupta say, we're not even in cold and flu season yet. Kids aren't in school right now. So demand could go even higher in the fall. Now, the manufacturers of these medications say that they are working tirelessly to try and meet the demand. Johnson & Johnson, which makes Tylenol, saying they are experiencing a record high demand for their products, but they're also producing and shipping at an all-time high, they say. But they do recognize there are shortages in parts of Canada. They know this is frustrating for parents who are looking for these products and can't find them. But again, they say they're doing their best, but no real end in sight to these shortages, John.
Thanks, Megan. Megan Fitzpatrick, live in Toronto.
You're welcome.